Benvenuti. La nostra rubrica 2 minuti con oggi è un ospite argentino molto importante, il dottor Maquirriain, che segue la squadra dei tennisti argentina e lavora, è medical director in Buenos Aires. La nostra domanda riguarda la prima. Do you remember the first question?
No.
La nostra domanda riguarda un bulging annulus in L4 in un giocatore professionista. What do you do in this player?
Okay, spine problems are very frequent in tennis players, even if they are competitive or recreational. As I told you to the audience yesterday, have to have a preventive look at those injuries.
But it has happened?
It has happened. We go to the intensive rehabilitation program, especially focused at first in the core stability, would not only mean that the abdominals work. No, the people think that they have a problem in the disc on the spine and look for the abdominals. So we have a broader approach to this problem, looking for stability, the core stability, including strength, endurance of many muscles, trying to work all together at the same time, for example. And after that, this kind of treatment is successful in the majority of patients. Patients it's very, very rare to need surgery at this stage. And after that, we can try some other modalities like a block injection, but majority of patients goes well with the rehabilitation program focused on the core stability.
È una domanda un po' più complessa forse per specialisti come il nostro professore. Nella spondilolistesi, anzi nella spondilolisi di un giovane atleta, come fare diagnosi differenziale se è nato con questo problema o se è l'esito di un sovrallenamento, un overuse in estensione causato per esempio nel tennis?
It's a very good question because around 3 to 5% of the people had a congenital spondylolysis, which means a small fracture of the pars interarticularis, a small part of the vertebra. When the young players, young athletes, not only tennis players, present with low back pain, we have to look very carefully to this part of the spine, of the lumbar spine. Thus we have two different modalities. For the X-rays, normal X-rays, and the CT, those modalities are very useful and can demonstrate the fracture, if there is a fracture line. But now, after obtaining these X-rays of CT, we have to look if there is an active fracture. So, do you need another kind of imaging modalities like SPECT or the bone scans or the even SPECT or even in the MRI. So that can depict if there is an active lesion. So it is a stress fracture, and then you can make the right diagnosis and then go to the rehabilitation program. And to prevent the listhesis with the displacement of one vertebra from another. Even if there is a listhesis, it can be treated as the low-grade listhesis can be treated in the same way that the lysis. So you don't need surgery for a listhesis. For example, if it has a high-grade listhesis over than the 50% of the vertebra, perhaps you need surgical stabilization.
50%?
50%?
50%? 50%?
The displacement, then perhaps you need a surgical intervention.
To stabilize.
Yes.
Okay. Thank you very much.
Thank you very much, Teresita.
Thank you very much to you.